Donations such as that from Marilyn Budke play such an important role because those donations give us some flexibility in the studies we can take out in the lab to move drugs forward. I'm Eric Prosnitz. I'm a professor here in the Department of Internal Medicine. I'm also the co-leader of the Cancer Therapeutics program at the UNM Cancer Center. The family that I study is called G-protein coupled receptors. They're a certain group of receptors, and there's about 800 of them in our genome, and they carry out functions in every tissue of the body. Turns out they can also play an important role in cancer. We undertook a campaign to identify new compounds that might selectively target this receptor, either stimulating it or inhibiting its actions. And that was carried out with a large team here at UNM, a large collection of other faculty and students and postdocs here in the lab. Some of the earlier studies that can be done in an academic research lab often are difficult to get funding for. There are multiple agencies to go to for funding, but donations really provide an essential gap sometimes to that funding, allowing us to maintain personnel in the lab. And it's really a vital component of our overall research effort to be able to do that and have those resources made available to us.
Being able to have the ability to train here and knowing that Marilyn Budke contributed to those funds to allow me to do research at the UNM Cancer Research Facility is amazing. I'm very grateful to have Dr. Prosnitz as my mentor because he has a training style that really suits my needs. So being able to ultimately contribute to research here at the UNM Cancer Research Facility from the bench and see and work with a mentor that has actually translated bench research to patients that is currently in clinical trials, and knowing that I want that in my own future and my career goals is really, really important to me.
This drug that we discovered here about right now, well over 15 years ago, saw its first patient take it in 2019 here at the UNM Cancer Center. So that was a really exciting day. Many more patients now, both here at UNM and at cancer centers around the country, have now participated in this phase 1 safety study. So far, all the results look really promising, and safety studies are now starting to be carried out in combination with immune therapy because that's the eventual intended use of the drug. The donation by Marilyn Budke has been vital to the overall progress in my lab here. It's been used to help support personnel in the lab and also provide other sorts of lab resources that might not otherwise be available to us.
Marilyn Budke not only is helping fund the cancer research here, but being credited to push legislation in the Legislative Finance Committee to develop the UNM School of Medicine. My medical school education wouldn't even be available if she had not identified that having a good medical school right here in New Mexico was important.